Okay, long-term care insurance. You're probably thinking, oh, yuck, long-term care insurance. I don't want to talk about any type of health insurance. Well, now that we've talked about the Deficit Reduction Act, the changes in the laws, the health insurance side is going to make a lot more sense to you. You're going to understand the difference between a normal individual health plan, a Medicare plan, an HMO, a PPO plan, a long-term care insurance plan. So you're probably wondering, what is long-term care insurance? Well, long-term care insurance, the difference is between a different health insurance plan is basically skilled care versus custodial care. Under an individual health plan, they cover skilled care. Skilled care is basically any kind of care where a person needs help after an accident, an illness, or an injury. It assists with the rehabilitation, recuperation after leaving a hospital. So you break both your legs, you need to go somewhere, and they're going to help you transfer around, help you walk again, get better basically. Whereas custodial care is more of a institutional care, the kind of care where you need help from a person and you are unable to perform 2 of the activities of daily living. So, and there are 7 of them. So what are the activities of daily living, you're probably asking yourself? Well, they are bathing, dressing, eating, transferring, continence, toileting, and walking. So you need to in order to get in a long-term care situation, you have to satisfy 2 of those, and a lot of those can be easily satisfied. A lot of doctors will actually. I ran into a guy that had a broken ankle, and a doctor said he would have passed him on meeting 2 of the activities of daily living. He had a hard time bathing, walking. He couldn't walk, so couldn't transfer, I should say. So that's where he would have satisfied those. That's where he would have been in a long-term care situation. Now, a lot of people think long-term care is nursing home care insurance, and I want to go over the structure really, because long-term care services are provided first of all at home health care, secondly assisted living centers, thirdly adult daycare, and last the nursing home. And everybody thinks long-term care is nursing home. Well, long-term care most of the time pays for people to stay at home for home health care because it is cheaper to keep a person in their home than it is to have them in a nursing home. So, but majority is home health care. And if you ever think of a long-term care situation, you think of like our John and Mary from our Deficit Reduction Act before we were talking about. Chances are John had, let's say, Alzheimer's, Parkinson's, something where Mary brought him home, so John was at home for a while, and eventually, Mary gets run down. She just can't take care of John anymore, so then they have to put him in assisted living or nursing home. So that is kind of the cycle that the long-term care situation goes through.